back to TV5 News at 9. This morning we're talking about interventional radiology with RMI. Joining us is nurse practitioner Patrick Hickey and Dr. John Morrison. And thank you both for being with us today. First, tell us, what is interventional radiology?
Well, interventional radiology is a subspecialty of diagnostic radiology, a medical specialty. And in that we use imaging guidance technologies like CAT scan, ultrasound, MRI, or live action X-ray to accomplish procedures to help diagnose and treat patients. So that can include things like a drainage or a biopsy, or things where we actually inject things into a patient, medications, or things like a bone cement or a steroid can be used in different settings for different purposes to help treat a patient minimally invasively.
And why would a physician send a patient in for this procedure?
Well, there are a variety of indications for these types of procedures. Many times it would be something that was detected by a physical examination in a doctor's office or on an imaging study that had already been done, and we might be following that up with something like sampling a tissue to make an actual diagnosis, or to actually treat, for example, something like a compression fracture of the spine in a person with osteoporosis to alleviate their pain.
And what's the typical patient experience like?
Patrick, I'll let you get that.
Well, typically, you'll be checked in by our check-in staff, and then once you're all checked in, they bring you back. You meet the technician or a nurse who would then explain the procedure to you, obtain your consent, make sure you understood all the risks and benefits of going through with the procedure. Sometimes, in some cases, we do provide sedation for procedures if they're particularly complex or, have the potential for discomfort. And then we move you over to the procedure area, where we'll use our ultrasound, X-ray, whatever imaging we're using to perform the procedure. We'll get kind of a first look at where we're going to go in. We'll provide local anesthesia via numbing at the site, and then we perform the procedure. Recovery typically is usually very short for our procedures. We move you to a post-procedure area where you recover. We watch your vital signs for a period of time afterwards, and then you just go on home.
And why would someone choose an outpatient facility for IR?
Well, hospitals are very busy places, and they're full of complex cases. Things can get very busy and very behind. So outpatient areas have the benefit of having less volume, so we can kind of get you in a little quicker, both in terms of scheduling and then in terms of checking in for the actual day of the procedure. There are fewer delays with us because we're not dealing with people who come up with very, very acute issues in the course of the day. So because of that lower volume and the less complex kind of situations that we're in, we're more accessible. Parking's easier, check-in is easier. There are fewer delays on a daily basis. And, as a team, we can kind of give a little more personal care because we don't have as many patients that we're dealing with on a daily basis.
And specifically, why choose regional medical imaging?
You want to take that on?
Yeah. Well, regional medical imaging is a practice that's been around for a little over 35 years. I've been here about 12 years now. But regional medical imaging is really a unique practice. You can't find the combination of things we have just everywhere. And it's the fact that we can provide the interventional radiology services, but we also provide a full spectrum of imaging services. And we have a very complete encounter for the patient. You can come here and have a study done, but you can also come here and have something done to help make the diagnosis you need further, or even initiate, or in some cases be your complete treatment. So everything in one place is something that we offer. As Patrick mentioned, just the size of the facility being not as big as a hospital, you can park and walk in, 50 feet to a check-in, and the number of people here is a smaller number, so you'll encounter people that you may have already met and be comfortable. People will be able to spend a little more time in a one-on-one encounter. So those are things that we pride ourselves on. You know, our motto is our family taking care of your family, and that's something that we accomplish through, you know, the number of people that have been here for years and years, and the small size and the personal nature of our practice.
Well, thank you both again. And you can find more information in the hot link section at WNEM.com.